It's actually probably transplanted over 3 million hairs. Is just slivering the strip down. So when we get it close here, this is for 10x power under the microscope, and basically dissecting. You can, I don't know how clear the picture is, but let's see. I'm looking at it here. It's a lot of light because the microscope emits a lot of light. But basically, what she's doing is she's got that strip and she's cutting it into sections that contain about 6 to 8, maybe 9 hairs per sliver, and then she'll take those slivers at the end and put them back under the microscope and cut them into individual follicular units. So in the meantime, she keeps them moist. We don't want them to dry out. So it's on, in this petri dish over here. We can show one of these, a couple of these slivers right here towards the end of the petri dish. That's what it looks like after each sliver, and you can see that there's ice underneath that to keep it cold. There's another sliver right there. So each of those slivers contains, you can see, that's pretty clear, that's about 10 hairs in that area. So we'll take that sliver afterwards and we'll cut it into individual follicular units of either 1, 2, or 3 hairs. So this is a long process because we have about 1,000 hair grafts to go through. So this will generally take a couple hours to do, and the patient is just relaxing while we're doing this. And when the numbing kicks in, I'll go back out to the patient in the operating room, and we'll start making the little slits that are going to house these hairs afterwards. This is a Meiji microscope, and it's one of the most common microscopes used for hair transplant. And we're cutting on a silicone block right there, and then underneath that is a harder silicone block. The top silicone block is just a little more smooth. The hairs glide across that a little bit better.
And the fluid is to keep it moist, correct?
The fluid keeps it moist because if you let the hair dry out, then there would be a problem with the hair grafts actually surviving. So we want to keep them moist and keep them cold, and then we would transplant them after when we're ready. I wonder if there's a different angle. Maybe if you come up here, come from the back. All I see right there is the light. It's very difficult to see because there's so much light from the microscope, but I think you get the idea there of how the slivers are being done. For a larger case, we would have several microscope stations going, but for a smaller case like this, we generally just do it under one microscope. And I see probably some questions here. Yes, we took the hair from the back of the head. I transplanted over 3 million hairs. Do both scalp and just slivering the strip. Facial hair transplants, we do a lot down. So when we get a close out of beard transplants up here, and it certainly does take a lot of hand-eye. This is for 10x power under the coordination, not microscope, and not every basically dissecting you can actually do something. I don't know how clear the picture like this. This takes a lot of training as well. But let's see. I'm looking at it here. It's a lot of because the microscope emits a lot of light. But basically, what she's doing is she's got that strip, and she's cutting it into sections. A lot of patients as well. That contain about and a lot of 6 to focus 8, maybe 9 hairs per sliver, and then she'll take those slivers at the end and put them back under the microscope and cut them into individual. We try to match follicular units, so match the hair. In the meantime, she keeps them moist in the back to any of the facial hair, and also don't want them to dry out. Beard hair happens, so it's on the single hair grafts, in this petri dish. It's not really the dish over here. We can show one of these 2s and 3s. If you look at a couple of these slivers right here, the normal beard. So here towards the end of the petri dish. If the hair doesn't match the beard, that's what it looks like after each. Then you wouldn't be a cantilever, and you can see that there's ice under it for it if it's very beneath that to keep it cold. Fine in the back and thick on. There's another sliver right there. The beard that you have, but so each of those hair grafts. In general, each of those slivers contains, you can see that's pretty clear. Let's find areas of the scalp where the hair, about 10 hairs, a little bit thicker, and hairs in that area, so it tends to match fairly well. We'll take that sliver afterwards and with beard hair cut it into individual follicular units in many patients of either 1, 2, or 3 hairs. So this is a long process because we have about 1,000 hair grafts to go through. So the hair, this will generally take hair starts growing in a couple hours in 3 months, and the patient is just relaxing after the procedure. And while we're doing this, it gets longer and it gets thicker. And when the numbing kicks in, thicker over time. So we generally go back out, take final pictures 12 months to the patient. It's after the procedure in the operating room, and we'll start making the little slits that are gonna house these hairs afterwards. This is a Meiji microscope, and it's one of the most common microscopes used for hair transplant. And cutting on it. I do have silicone block, right? Both facial plastic surgery there, and then underneath that is surgery and hair restoration. A harder silicone block. I don't do any surgery. Use on the body. The top silicone block but at Lexington Plastics a little more smooth. The hair surgeons, we glide across that a little bit better. I have Dr. Jones and Dr. Ginsburg, who do the body surgeries.
And
so we at Lexington Plastic Surgery.
The fluid is to keep it moist, correct?
Surgeons pretty much do. The fluid keeps it moist because almost any cosmetic, you let the hair dry out, cosmetic, body or then there would be a facial or hair procedure that you problem with the hair can think of. Grafts actually surviving, so we want to keep them moist and keep them cold. It's not covered by insurance, and then we would transplant them after. Hair restoration works because you take them already. Taking hair from one part of the body, which is the back of the scalp, and putting it in an area that the patient needs it. I wonder if there's a different angle. And that area, maybe if you come up here, had hair that was just susceptible to androgen, and all I see right there is the light. There was hair loss, but we're taking it from an area where it's not susceptible to those same hormones, and it tends to survive. It's very different, just like it would on the back. It's called donor. Difficult to see because there's so much dominance. Light from the microscope, but I think you get the idea there. Of if you shave your head afterwards, you would probably see the scar, but how the slivers are being done. If you leave it with a number 3, which is 3/8 of an inch, most patients for a larger case we would not going to be able to see the scar in the back. Of several microscope stations going. Hair restoration is the same. But for a small transplant, yes. In a case like this, we generally just do it under one microscope. Yeah, we just talked. And I see something about LeBron. But some questions here. Yes, we took the hair from 15 minutes ago. The back of the head. I do both scalp and facial hair transplants. We do a lot a lot of beard transplants, and it certainly does take a lot of hand-eye coordination. Not every tech can actually do something. Well, we just talked about that like this. This takes a lot of training. It's 15 minutes ago, but we're not not sure. We have some reason to believe that he did, and other reasons to believe that he didn't. So I don't think anybody knows the true answer except for the surgeon that might have done it. It takes a lot of patience as well. It's very hard to and a lot of tell if someone had a focus done because it's so natural afterwards, and it's very hard to see the scar, even with short hair like LeBron. We try to match the hair
And for the people who maybe just joined
in the back to any
and asking about
of the facial hair, and also
the cost of this procedure.
beard hair happens. The cost starts in the single hair grafts. It's at $55. It's not really the $100, and that's 2s and 3s. If you look at good for about 1,000 normal beard, so 1,000 grafts, which is it's about 2,200. The hair doesn't match the beard hairs, and that covers everything. Then you wouldn't be a canning. But for it, if it's very larger procedures, would fine in the back and thick on, be higher priced. The beard that you have, but in general, you can find areas of the scalp where the hair is a little bit thicker, and it tends to match fairly well with beard hair on many patients.
Products and oils, can they restore hair?
The hair
In bald areas?
there's a lot of hair starts growing in products on the market in 3 months. Some of them are after the procedure, and most of them are not really regulated, but it gets longer and it gets to the FDA thicker over time. So we generally only the prescription medication. Final pictures 12 months are regulated by the FDA after the procedure. Okay, and there's certainly reports that certain products may help or may not help, but most patients try a few products, and if they don't work, then they come in for hair transplant procedure, fix things. I do right now. What we're doing is both facial plastic surgery, slivering the surgery, and hair restoration. Strip of hair that we took. I don't do any surgery from the patient's head. We use on the body. And once at Lexington Plastics get all the slivers, surgeons. Then we're going to take each of those slivers, have Dr. Jones and and dissect it into Dr. Ginsburg, who individual follicular do the body surgeries units, which can contain anywhere from 1, 2, or 3 hairs. So we at Lexington Plastics Church at the max. Pretty much do. So that's the process. Almost any cosmetics we're doing right now. Cosmetic, body or facial or hair procedure that you can think of. It's not covered by insurance. And Rhiannon, someone has asked hair restoration works because you're taking if your hands are cramping. Taking hair from one part of the
No.
no? Body, which is the back of the skin.
get used to it.
Scalp and putting it in an area
After so many years.
that the patient needs it, and that area had hair that was susceptible to androgen, and there was hair loss, but we're taking
That's insane. I wish like
it from an area where it's not
people could see even
susceptible to those
better like
same hormones,
Shoulder?
and it tends to survive. It's just like it would on the back. It's called donor. It's a heavy light on it.
yeah,
Dominance.
yeah, same with surgery.
The
Like
transplant,
when
yeah.
Does it help if I drawn the light out a little?
If you shave your head afterwards, you
So we're coming to you guys from New
would probably see the scar, but if
York City. Dr. Ende,
you leave it with a
he works here in our New York
number 3, which is 3/8
City office.
of an inch, most patients are not going to be able to see the scar in the back. How long does that take? Hair restoration is the same. It takes same as transplant, yes. Depends on the patient, but it could take a few hours. It could take all day. Yeah, we just talked. Depends on how much about LeBron, about how many hairs we're doing. It depends. 15 minutes ago. On how curly the hair is, or how straight it is, what color it is. This is not Bosley. This is Lexington Plastic Surgeons.
Is it harder to do on certain ethnicities?
Yes. Well, we just talked about that. But it is harder to do on certain ethnicities 15 minutes ago, but we're not. Cities we do all. Sure, we ethnicities here though. We have some reason to believe that he did, and other reasons certain to believe that he didn't. So patients tend to have curly hair. I don't think anybody knows the true answer, which makes sense except for the surgeon that might have done it. It's a little more tedious to trace out each of the curls. It's very hard to, but however, tell if someone had it. Whatever the hair is, we work around it, and because it's so natural afterward, we're able to complete. And it's very hard to complete the procedure. It just takes longer to see the scar with curly hair, even with short and certain other short hair like LeBron characteristics, which if you would come in for a consult, we would explain your individual needs and how long we think yours would take, and whatever other questions you had.
And for the people who maybe just joined and asking about the cost of this procedure.
Sure. The cost starts at $5,500, and that's.
Oh, that's great.
Thank you. Good for about 1,000 grafts, which is about 2,200. Don't do any breast procedures. I have hairs, and that covers everything. I only do facial cosmetic surgery, but larger procedures would be in hair restoration, be higher priced. I don't do a little bit of everything. I just do a lot of the same thing.
And somebody else, if this is similar to the Bosley procedure?
It's very similar to what Bosley does. So, I like to think it's a little bit different in certain ways, but for the most part, it's the same. And
Products and oils, can you
at Lexington Plastic
start
Surgeons, I do.
hair in bald areas?
There's a lot of all of the different types of hair products on the market, and hair restoration. Some of them are all the different types of hair. Most of them are not really regulated by transplantation as well, the FDA. This one is only the prescription medication, a strip procedure, but those are regulated by the FDA. We also do follicular unit extraction, and there's certainly traction. They reports that certain with a motorized unit products may help or may not help. Not just a manual, but mobile FUE extractor. Like most patients, like some clinics have, we have a motorized, try a few products unit here. And if they do, we also do the strip don't work, then they come in, and we also do hairline for, lowering. Hair transplant procedure. We work with a lot of African types to fix things. Hair, we use the strip procedure for that. Right now, what we're doing is, and it just takes slivering the, a little bit longer than strip of hair that we took from what you're seeing here with the straight hair from the patient's head. But it's certainly certainly possible, and the results are great. Get all the slivers with curly hair. Actually, then we're going to take each of those slivers. The results are better with curly hair sometimes, and dissect it into individual follicular units, which can contain anywhere from 1, 2, or 3 hairs at the max. So that's the process we're doing right now.
We love bringing you guys in the operating room. It's
Rhiannon, someone is
fine if other doctors don't.
asking if your hands are cramping.
We have the explicit
No.
No?
approval from our
Get used to it.
patient to allow
After so many years.
us to film this. It's really educational and, gives people a better idea of what they can expect from a procedure like this. Dr. Ende, do you want to speak a little more? It's insane. I wish to that.
Sure. I mean,
People could see even
certainly if I was first
better,
starting out doing these
Shoulder?
procedures, I maybe wouldn't want to have heavy light on it.
Yeah,
Be filmed doing that, but
same with surgery.
at this point I've done over 10,000
It'd help if I
surgical procedures on the face
drawn the light out a little.
and the scalp, and
So we're coming to you guys from New
we're pretty confident that
York City. Dr. Ende
things are going to go right,
works here in our New York
and we're pretty comfortable with
City office.
everything. And like I said, Rhiannon has transplanted over 3 million hairs. How long does that take? I'm pretty sure she's takes confident enough. It depends on the patient, but it could take filmed at this point as well. Take a few hours. It could take all day. And Rhiannon's been doing this on how many this with me, how many hairs we're doing. It depends on let's see, 2000. How curly the hair is or how straight it. A little over 6 years it is. What color it is. Point. This is not Boston, so this is Lexington Plastic. When you work with someone for that, surgeons, long, we're pretty comfortable, showing you what we
Is it harder to do on
do, and our patients are very happy.
certain ethnicities?
Yes, with their results. So it is harder to do on certain ethnicities. I have no problem, showing ethnicities. We do what we do on video. There'll be ethnicities here, though. More videos to come with some some of the other types of hair restoration that I do as well.
Yeah, that'd be great.
Patients tend to have curly hair,
Great.
which makes it a little more tedious to trace. This is an interesting trace out each of the curls. Media doing it live, but however, I know a lot of people do things on where the hair is. We work around it, YouTube, and we're able to complete. Perhaps they edit in between the procedure. It just takes longer between just to shorten it, and with curly hair, take out some of the parts, and certain other hair care. What you're watching is basically characteristics, which is live surgery right now. If you would come in for a consult with no editing, what we would explain
And somebody
your individual needs and
asked if it's possible to revive
how long we think yours would take, and
with dead follicles.
whatever other questions you had. Well, there are certain injections that we do here at Lexington Plastic Surgeons called P, which is,
Oh, that's great.
thank you, platelet-rich plasma. And no one knows exactly how it works. I don't do any breast procedures, but the theory is that I only do facial cosmetic surgery, basically in hair restoration. It stimulates your own body. I don't body's stem cells, do a little bit of everything. To reproduce the hair, I just do a lot of the same thing that was once there.
And somebody
A lot of times we combine that
asked if this is similar to the
with a hair restoration, and we also
Bosley procedure.
it's very offer that similar to what Bosley does on its own, and these studies and our experience. I like to think it's a little bit different in certain show that it does increase hair in ways, but growth approximately for the most part it's the same, and 16%. At Lexington Plastic Surgeons I do so it's certainly not as much all of the different types of hair as doing a hair transplant, but hair restoration is something. If someone did all the different types of hair want to do surgery, they could get injection transplantation as well with the PRP. And this one is basically what we're doing is a strip procedure, but we're drawing blood. We also do follicular unit from you and then putting it in a central traction fused with a kit and with a motorized unit, and it's extracting the PRP, which is not just a manual. It's basically your own body's growth FUE extractor factors. And some clinics have. We have a motorized, and we inject that back into your unit here. Scalp either by itself. We also do the strip or with a hair restoration procedure, and we also do hairline, and we also would soak the grafts lowering. We in it. That is an additional. We work with a lot of African type cost, though not everybody hair. We use the undergoes that strip procedure for that part of the procedure. The results, and it just takes great even without it, but it a little bit longer than only add to the results. And what you're seeing here with the straight hair, that's the only thing. But it's something that I'm aware of that certainly possible, and the results are great. It's reliable. They're with curly hair. Actually, like I said before, there's certainly a lot of different results are better with curly hair sometimes. Different hair products and lotions and creams and things like that, and pills on the market, but reviews are generally mixed for pretty much anything like that.
Can you do the PRP preventatively?
There's some studies
We love bringing you guys
that are showing that it can be prevented
in the operating room. It's
and there's
fine if other doctors don't.
a lot more studies being done right now.
We have the explicit
About PRP,
approval from our
but
patient to allow
soon we will know within the
us to film this. It's
next few years, but we know that there's no
really educational
real side
and gives people
effects from it, and
a better idea of what they can expect
fairly safe. I haven't
from a procedure like this.
seen anything happen other than a little bit of swelling
Dr. Ende, do you want to speak a little more
here and there.
to that?
Sure, I mean, but you can certainly, if I was first starting you can do starting out doing these preventative. A lot of patients that come in procedures, to do it preventatively. I maybe wouldn't want to as well. There's a lot of be filmed doing that, but literature about it. At this point, the reviews are very done over 10,000 positive surgical procedures on the face throughout the internet on it, and the scalp, and we're pretty confident that
Somebody asked
things are going to go right.
what age do you generally
And we're pretty comfortable with
start to lose hair?
everything. And like I said, Rhiannon, everybody's different in terms of has trans of the age that they start to lose. Planted over 3 million hairs to his hair, but so I'm pretty sure she's in general confident enough to filmed at this point as well. There's male pattern, and Rhiannon's been doing this where there's different this with me and classifications of that, and for different patterns. Let's see, 2000, and most men, a little over 6 years, tend to fit into point one of those patterns, and so sometimes it can start in when you work with someone for that 10 years, and sometimes it's long. we're pretty comfortable. It doesn't start until you're comfortable, showing you what we do. So whenever you do, and our patients are very happy, start to lose hair with their results. That's when people start considering no problem, showing a hair restoration procedure. What we do on video, there'll be more videos to come with some depends on your genetics and your family, the other types of hair restoration, family history that I do as well.
Yeah, that'd be great.
There's a lot of different things that are
Great.
involved with that question. There's also genetic tests. This is an interesting, can be done, but media doing it live, they're expensive, and so I know a lot of people do things on, they don't really help at all. YouTube, and because there's nothing you can do genetic, perhaps they edit in between to prevent it. Between, just to shorten it and
Somebody said they read somewhere that
take out some of the parts, but
you typically would get it from your
what you're watching is basically
mother's father side?
live surgery right now. Yeah, that is the high with no editing. Yes, percentage.
And somebody,
But it's not 100%.
if it's possible to revive
But if you're
dead follicles.
if you want to, well, there are certain closest family member to what your injections that hairs. It's generally would be your mother. We do here at Lexi's father, but again, it's not 100% in plastic surgeons. It's called PR, nowhere near 100%. P, which is in that regard platelet-rich plasma, and no one knows exactly how it works, but the theory is that basically it stimulates your own body's stem cells
This lady
to reproduce the hair
had a full hysterectomy now.
that was once there.
She's experiencing
A lot of times we combine that,
baldness.
certainly with a hair restoration, and we also anesthesia, offer that general anesthesia sometime on its own, and these or stress studies and our experience from major surgery like a hysterectomy that it does increase hysterectomy, can cause hair loss growth. Approximately, so it could be other factors that 16% have caused it. So it's certainly not as much. You should get an evaluation. This is doing a hair transplant, but to see if there's anything else going on. It is something. If someone didn't want to do surgery, they could get injections with the PRP, and basically what we're doing is drawing blood.
Sorry guys, this is only in English.
From you, and then putting it in a centrifuge.
We are not
Fused with a kit, and
French speakers. Unless
it's extracting the PRP, which is
Dr. Ende, you are.
it took basically your own body's growth. French in high school and factors and college, but that's a long time ago. And we inject that back into your so I don't really scalp either by itself or too much, or with a hair restoration procedure. And we also would soak the grafts in it. That is an additional cost, though. Not everybody undergoes that part of the procedure. The results are great even without it, but it can only add to the results. Most patients really don't miss work. That's the only thing. I've had 2 procedures done that I'm aware of that myself, and is reliable. I went back to work the next day. Like I said before, there's certainly a lot of different. Depends on hair. If you're doing any heavy lifting or anything, products and lotions and cream like that. But if there's no heavy creams and things like that lifting, most patients can pills on the market and go back to work the next day. But reviews are generally mixed for pretty much anything like that.
Can you do the PRP? We'll be back. Preventatively?
Why don't we, we'll take a look. There's some study break here, and then that are showing that it can be prevented. We'll be showing you some live surgery, and there's a surgery on how we make a lot more studies being done right now. Hair slits. About PRP. Those hairs are actually going to be going in the picture. But, patient.
Tune in.
So soon we will know within the next
Soon, guys.
few years, but we know that there's no real side effects from it, and it's fairly safe. I haven't seen anything happen other than a little bit of swelling here and there, but you can certainly you can do it preventative. A lot of patients that come in to do it preventatively as well. There's a lot of literature about it, and the reviews are very positive throughout the internet on it.
And somebody asked, at what age do you generally start to lose hair?
Well, everybody's different in terms of the age that they start to lose hair, but in general, there's male pattern baldness, where there's different classifications of that and different patterns, and most men tend to fit into one of those patterns, and sometimes it can start in your teen years, and sometimes it doesn't start till your 40s. So whenever you start to lose hair, that's when people start considering a hair restoration procedure. Depends on your genetics and your family history. There's a lot of different things that are involved with that question. There's also genetic tests that can be done, but they're expensive and they don't really help at all, because there's nothing you can do genetically to prevent it.
Somebody said they read somewhere that you typically would get it from your mother's father side?
That is the highest percentage, but it's not 100%. But if if you want to get the closest family member to what your hair is, it generally would be your mother's father. But again, it's not nowhere near 100% in that regard.
Oh, this lady had a full hysterectomy. Now she's experiencing baldness.
Certainly anesthesia, general anesthesia sometimes, or stress from major surgery like a hysterectomy can cause hair loss. There could be other factors that have caused it, so you should get an evaluation to see if there's anything else going on.
Sorry guys, this is only in English. We are not French speakers. Unless Dr. Ende, you are.
I took French in high school and college, but that's a long time ago. So I don't really remember too much. Alright, so most patients really don't miss work. I've had 2 procedures done myself, and I went back to work the next day. Depends on if you're doing any heavy lifting or anything like that. But if there's no heavy lifting, most patients can go back to work the next day.
You want to see? We'll be back.
Why don't we we'll take a little break here, and then we'll be showing you some live surgery on how we make all the hair slits, where those hairs are actually going to be going in the patient.
Tune in soon, guys.